I live in Oxford and I love it.
I absolutely love it.
Love it. I love it.
Absolutely love it. I love it. I love living here.
We've had quite steady growth in the township, as has the Waimakariri district. The whole Waimakariri district has had quite phenomenal growth, really. I think we're the third fastest growing district in the country. And that's brought its challenges. We've got obviously more businesses here, more people here. It would be good if we could get more services locally to stop people having to go into Christchurch or Rangiora.
So the group was formed in August 2016 after a community meeting that was held, where we identified different areas in health where Oxford may or may not be meeting the standard of city counterparts, and sort of looking to provide a good overall equitable service.
I'm Emily Chapman and I work for the Oxford Community Trust, and I am bringing a youth perspective.
I had some personal health experiences myself, and there was no roadmap or no guidelines, so I really wanted to have input. So if anyone was travelling a journey, they had a map, a guidance, because sometimes it's quite scary and daunting.
I bring the community sort of pharmacy, rural pharmacy outlook. I've worked in rural pharmacies in different places as well as Oxford.
My name is Judith Miller. I'm one of the GPs at Oxford Community Health Centre.
My concern is advocating for patients and for the community at large, and ensuring that there's an equality of services between the rural and urban populations.
I'm a physiotherapist, so I have been the allied health perspective for the group. And it was important to be involved because I've worked in this area for several years through the DHB and privately, and I'm very aware of where some of the gaps are for services for people in the rural communities like Oxford and surrounds.
I think it's important. I have 3 young children and I want to know that their healthcare needs are met just the same as they are in Christchurch. Being rural, it's a bit difficult to come to services all the time. We're very lucky out here, we do have a lot, but there are some things that need working on.
We get a lot of search and rescue type work with Lees Valley. We've got the riverbed, so we get a lot of search and rescue calls, which does warrant some medical assistance, and the police obviously have a big part of that search and rescue response, along with our Landsar volunteers, and there's always a medical person on standby to assist.
My name's Jo Elam from Oxford. I'm really here to tell you about sustainable transport for any of our patients, social service activities to get people into Christchurch in an easier way and more affordable way.
What we did is we used some what we call patient journeys to actually look what happens at the moment, and applied those 6 areas, and then it grew into 10 areas when we actually looked at that. But we used what happens first, and also what people's opinions already were and how we can improve that.
One of the things we've been looking at is telehealth, and I think that would be a fantastic thing for Oxford, where as opposed to travelling into Christchurch for checkups and forwarding services and that, you could pop into the clinic and visit your specialist via telecommunications, which would just, I think, be fantastic, save heaps of time and less stress for the driver.
In Oxford Community Health Centre, we've got rural nurses who work here at the top of their scope. We've had nurse practitioners trained here before, but that is actually quite a difficult process, and we would really love to be able to work with other health providers in this area and develop an actual recognised pathway for nurses to work up to nurse practitioner or nurse prescribing, or extending their ability to run clinics independently. And by that we improve the scope and the number of patients that we can see and the complexities of patients that we see here as well. If we are planning to open sort of a flexi observation bed at Oxford Hospital, then the telehealth could be used to get advice from the ED doctors or an on-call registrar at Christchurch Hospital.
One of the major themes that we found running through actually all of the proposals was transport, and so that sort of became our number one priority, because without transport to get people to services, even to the local hospital, pharmacy, it was a real issue.
Living out in these rural areas, the transport is so difficult to work in with them. So moving the transport issues forward, we've met with ECAN and some local bus operators in the area. This is going to take a huge effort from a lot of different operators to try and piece together this service that we require.
So one of the proposals that we've come to discuss in the Oxford Health Development Group is around a restorative care model and a CREST-like service, which is similar to they have in Christchurch, which is a short-term intervention with carers and therapists helping people get back up onto their feet and regain their independence.
So restorative care encompasses a wide range of services, from pharmacy services, pharmacists coming in, going through your medications, making sure you understand, to the physio, perhaps helping you after stroke, to become able to do your day-to-day activities, to someone coming in and helping with laundry, making sure you can do all of those things.
Areas that we've looked at is the need for mental health provision. One of the things that we see is that there is a gap in services between simple counselling and then the severe mental health, where people are engaged with the hospital providers and psychiatry. And we'd be looking to see if we can build up more support for patients who are sort of caught between that minor level and very severe, requiring hospitalisation.
I've asked a few people their thoughts, and they've thought about it but never actually come to me, so please do if you've got anything.